Greetings from Chesa Dental Care. This is Vinay Kuru. I'm working as a product specialist for the Woson range of autoclaves with Chesa Dental Care since the last 4 years. In my previous 2 videos, I talked about and discussed what is the importance of sterilization and why to use an autoclave in a clinical or dental practice. Also, I tried explaining the difference between a N class and a B class autoclave. Now in today's video, I'm trying to answer a question why we need printer in an autoclave. The reason for this topic is basically we as Chesa Dental Care Services have a model called as Woson 23 liters with printer model, and we often, while discussion with dentists or other customers, do get this question. So we are trying to answer the same here. First of all, let us understand what does the printer do. Printer basically gives out a printout of the cycle data. Now what I exactly mean by cycle data? Cycle data, what I mean by is the temperature at which it was set. Say for example it is 121 or 134. What was the time taken for the complete cycle, which would include the preheating, vacuum and drying and everything. Also, what was the load cycle selected, whether it was wrapped or unwrapped or other programs. And this way, the complete sterilization data is received. This printout comes out soon after the sterilization cycle is over. So this document or evidence is that sterilization is completed, and this can be documented by the doctors on a daily basis. Also, in case of a scenario where the main dental surgeon who is running the clinic, he himself is not monitoring the performance of the autoclave, these printouts can be an evidence to see the monitoring of the performance of the autoclave. Because even if there is a cycle failure, the same will be shown in the printout. The next scenario is that if the doctor is considering to do a NABH accreditation of the clinic or a ISO certification or any other kind of accreditation for the clinic, such sterilization documentation evidences is very necessary as per the protocol or guidelines set by those organizations. And the next scenario would be if any patient comes up and says that proper sterilization standards are not maintained in the clinic, or if any case of infection comes up, or if there is any medical legal case may happen, then these documentation evidences can be helpful to show that proper sterilization standards were maintained by you in your clinical practice. The reason being, the printout which comes out of the cycle even has the date mentioned on it, on the date in which you had done the sterilization. So basically, for all these points, printer becomes very essential inside an autoclave. If you are considering autoclave with printer, we as Chesa Dental Care has the 23 liters with printer option. You can always get in touch with me or Chesa Dental Care Services for any further queries or details about the different models we have. Please do follow Chesa Dental Care Services on their Facebook and Instagram page. We have a very big team of sales and service support throughout India. So we would be in a position to provide sales and service pan-India. We are proud to say that majority of our customers are quite happy with the products we are supplying them. I believe this small session was helpful to you in understanding the importance of printers. Thank you.